Any woman who is diagnosed with spina bifida in her pregnancy might be a candidate for fetal surgery anywhere between 19 and 26 weeks gestation. But we are interested in seeing all patients who have the diagnosis of spina bifida because there may be other options for those patients as well. We believe that UCSF is the ideal place to come have surgery for spina bifida. The knowledge about how to open the uterus, how to manage a mother, was all gained here initially at UCSF, and we now have over 30 years of experience on operating on women with disorders of their fetus. For a woman who chooses fetal surgery for spina bifida, she undergoes an operation herself. She'll have a general anesthetic, she'll undergo an incision in her abdomen to expose the uterus, and then we make a very special kind of incision on the uterus. Once the fetus is exposed, the neurosurgeons come and do that operation. The fetus is put back inside, and the maternal uterus and abdomen are closed. Most of the time, a woman recovers from this operation in about 3 to 4 days. We then like to keep you close by for the next few weeks to make sure that the uterus is not contracting abnormally.
The fetus has very different tissues from a full-term baby, so we have to adapt that repair to the circumstances. So in the fetus, what we're trying to do is a multi-layer repair. The goal is to try to reapproximate the normal tissues and to provide a cover and a barrier to this normal central nervous system. And hopefully that way we can protect some of the consequences of having an open spina bifida or open spinal cord during the second half of pregnancy. What we always try to do is to bring the normal tissues of the fetal back into the normal alignment. In other words, the opening in the back, which defines spina bifida, we try to repair that by bringing the normal skin, the normal dura, and the spinal cord into their normal position. In the fetus, the big challenge is that the tissues are so soft and so delicate that sometimes we can't really manipulate them or bring them into the normal position. If we can't do that, if we can't bring the skin together, then what we have to do is one of two things. We either use a synthetic absorbable patch that reapproximates the purpose of the skin for those several weeks that the fetus is still in the mother. The other option, which we do very little of now, is to actually make relaxing incisions along the side of the fetal back so that we can close it in the midline. The problem with that approach is that it does leave scars that we generally don't like, and we think the patch does just as good a job. So our primary goal is really to do and approximate the normal tissues, but if that's not successful, we'll be using patches for the skin.
If one were to come to San Francisco to get treatment for spina bifida, some patients might need to stay in San Francisco for the remainder of their pregnancy, but we anticipate that the majority of women after fetal surgery will be able to return to their home environment.